Welcome to Friday's edition of COVID-19. I'm Min Sun-hee. As part of their continued efforts to contain the recent outbreak, authorities have decided to extend the limit on the number of people who can gather for a rally here in the capital region to 10 for 2 more weeks. For the rest of the country, the measures under social distancing level 2 will continue for another week. We start the program now with the latest numbers on the pandemic with our Kwon So-ah and related news with our Oh Jung-hee. So there has been a slight drop in the number of cases on this Friday, but I understand this is no reason for relief.
Exactly, Sunny. You know, whenever we see a decline in on-day cases, I feel like we should be extra careful not to let our guards down, because Thursday's figures of more than 400 cases, that can happen anytime again. And this is especially important at this time, and that's why we have to abide the social distancing measures at this crucial time.
Right, the social distancing measures. I'll go into detail with that with our Oh Jung-hee later, but So-ah, do give us a brief preview.
Yes, so the government has been making a number of announcements regarding these social distancing measures. They are now dubbed the 2.5 level of social distancing measures. And just recently, we heard that there are new measures regarding coffee shops and restaurants. As you said, Tong-hee will go into the details related to that. But basically, level 2 social distancing measures will be extended for another week in the capital region, which means the entire nation will be under those measures, as they became mandatory a week later than in the capital region. And also, Seoul has separately extended its ban on rallies of 10 or more people for 2 more weeks. And with that, let's take a look at Friday's figures. We have 371 new cases. So the total accumulation of cases in Korea has surpassed 19,000, and the death toll stands at 316. We have an additional 3 deaths reported. That is more than what we've been seeing lately, because there is a higher number of people in critical or severe condition. Meanwhile, some 4,200 people remain in quarantine, and we have 90 new recoveries, raising the total to 14,551. And if we go over to our graph, you can see we have been seeing fluctuations between the 200s and even the 400s, and these figures have been in the triple digits now for around 2 weeks. Now let's move over to our map. As you can see, the entire nation is seeing cases in some places more than in others. Of course, the metropolitan region is affected the most, with 146 in the capital, so a slight drop from yesterday, followed by 113 in Gyeonggi-do province and 27 in Incheon. And another hotspot is Gwangju, again seeing double-digit figures when it comes to new coronavirus cases. And now let's move over to the international front. So we have a total of over 24.6 million cases, with almost 300,000 new cases reported in the past 24 hours. The death toll stands at over 835,000, and in the meantime, we have almost 17.1 million recoveries. And let's take a look at the hotspots around the world. The US at over 6 million cases, and India is the country with the fastest rise in cases, still having reported more than 70,000 cases in just a day. And it looks like South Africa, Peru has surpassed South Africa in total cases with over 621,000. And if we go over to our next table, there is another change here. Colombia has surpassed Mexico in total cases, but just a day ago, this order was the other way around. So it looks like they are going back and forth these recent days. And also here, Argentina is seeing around 10,000 cases on a daily basis. So big concern over there as well. And those are the figures I have for now. Stay safe, everyone, and back to you, Sunny.
All right, so thank you for that. We'll see you back next Monday. Right, despite widespread speculation about a possible rise to level 3 social distancing, authorities have decided to maintain the current level 2 guidelines. I have our Oh Jung-hee with me here in the studio for more on that decision and on other related news. Welcome, Chung-hee.
Good afternoon.
Right, Chung-hee, let's begin with the government meeting that was held earlier this morning.
Right, Sunny. After weeks of will they or won't they, the government finally decided to maintain the current social distancing level of 2 for another week. For the Seoul metropolitan area, the government has been actually hesitant about raising the current social distancing level to the highest level of 3 because it could deal another significant blow to the already damaged economy. But, the government still had to take an action to curb the current outbreak. This is actually what South Korea's Prime Minister Chung had to say this morning.
Level 3 social distancing is the last card at our disposal, considering its economic and social impact. The government will extend the current Level 2 measures, which were to expire this weekend, but with added preventive measures such as limiting the operating hours of restaurants and cafes. We ask for all your help.
Up until now, cafes and restaurants have been operating more or less normally. Only large gatherings, sporting events, schools, entertainment facilities, among others, have been affected. But starting this Sunday, for 8 days, we have a couple of regulations and restrictions to be imposed on cafes and restaurants. A couple of details have been released just now at a briefing held 30 minutes ago. Starting this Sunday, people won't be able to eat in at restaurants during night, that is 9 p.m. to 5 a.m. in the morning. And at franchise coffee shops, only takeouts will be allowed. That means no more chatting, no more staying, or no more studying at coffee shops from now on. And that is to last for 8 days starting this Sunday.
Right, I understand those are some very stringent measures we have there. Chung, there's also much concern over the growing presence of untraceable cases. Could you tell us a bit more about this?
That is right, Sunny. Actually, at the government briefing held yesterday, Kwon Jun-wook, the vice chief of the country's disease control headquarters, said that out of the 434 cases of local transmissions reported yesterday, the government actually could not trace the source of infection for over 30% of them. This is actually a serious situation, and the government says the current spread of the virus is very serious and grave, with new patients being reported in areas other than the Seoul metropolitan area, and that anyone can be infected no matter where they are. Now, there are growing calls from not only medical experts but also Parliament and the ruling party even that the government should consider raising its social distancing level. They point out that socioeconomic losses from a full-blown nationwide outbreak will be more serious than that from level 3 social distancing measures. Take a listen.
Considering the gravity of the situation where a nationwide outbreak is a distinct possibility, we asked the government to review the advice of medical experts that level 3 social distancing must be adopted temporarily for 5 to 7 days in the greater Seoul area despite the impact on the economy.
Right, now speaking about the economy, the Bank of Korea has lowered the country's growth forecast to minus 1.3% for this year here.
Right, Sunny. Back in May, the nation's central bank had actually forecasted that the Korean economy would shrink by 0.2%, saying that this is the first negative growth in 22 years. But at the latest projection released just yesterday, the country's economy is now expected to contract 1.3%, according to the Bank of Korea. In a worst-case scenario where the resurgent outbreak extends into the winter, the bank expects the nation's economy to retreat by 2.2%. The bank also lowered its 2021 growth outlook to 2.8% from its earlier estimate of 3.1%. It explained that the slump in exports will ease gradually, but the recovery of private consumption is expected to be constrained.
I see. Chung, I hear the latest outbreak is also affecting our already limited travel options.
That is right. For one, Taiwan's health authorities actually excluded South Korea from its list of mid and low-risk countries, citing the recent spike in cases in South Korea from churches and mass gatherings. From now on, people traveling to Taiwan from South Korea will have to go through 14 days of quarantine. The quarantine period was actually shorter beforehand for people with business purposes, but from now
on, business travelers will also have to quarantine themselves for 2 weeks. Meanwhile, starting this weekend, Singapore will also require all arrivals from Korea to quarantine themselves at government-designated facilities. These are tighter measures compared to before because previously those coming from Korea could choose to quarantine themselves at their own accommodations.
I see. All right, Chung, thank you for that coverage. Hope to see you again soon.
My pleasure. Thank you.
Right, the regular afternoon briefing on COVID-19 has been delayed to 2:20 today, so we bring you this next segment first. Early in its battle against COVID-19, Korea tackled its hospital bed shortage by reserving beds for the elderly and severely ill and placing the asymptomatic and mildly ill at the so-called residential treatment centers. For more on these centers, I have our Chun Song-cho at one such facility here in Seoul. Hello, Song-cho.
Good afternoon, Sunny.
So, Song-cho, I hear you are at a residential treatment center.
Well, in particular, I'm actually right next to the CAPCO HR Development Institute located in the northeastern part of Seoul. So you might be wondering, what am I doing here? What am I doing at the training center of the country's largest electric utility? Well, on August 22nd, when South Korea started seeing an uptick in COVID-19 cases once again, this place was converted into an isolation facility for COVID-19 patients. Why? Well, this was so that the mildly ill and asymptomatic patients could be treated and monitored outside the hospital. So this so-called live treatment center is for patients that do not need to be hospitalized. So if you test positive for the virus, but do not show symptoms or only have mild symptoms like fever, fatigue, and dry cough, then you'll be directly transferred to these centers after being diagnosed and triaged at the screening clinics. Now, these centers really helped keeping the fatality rate of COVID-19 in South Korea low because the centers allow relatively healthier patients to get better treatments and care that they need. And also, if all the new patients were crammed into the hospitals, then that could have really overwhelmed our healthcare system, which then could lead to serious shortages of medical supplies and services. So this No1 live treatment facility in particular has 124 inpatient beds, and there are around 30 medical personnel, including 10 doctors from the Seoul National University Hospital, nurses, pharmacists, and radiographers. They are on standby around the clock examining the patients here twice a day, all through video calls. Now, the center really filled up quickly, just within 2 days of being operation, really. And other centers located near Taedong Athletes Village and also in Namsan Mountain also are said to be at near full capacity now. So the Seoul City government turned the Eunpyeong Fire Department Training Center into a live treatment center just yesterday. So there are growing concerns over a possible strain on medical staff as well as hospital beds. But the problem is we still have yet to flatten the COVID-19 curve. So if we want to really prevent this current flare-up to turn into even worse one than what we already have right now, then we really need everyone's cooperation and commitment to practice and adhere to strict public health protocols, and that is practice hand hygiene diligently and also avoid outdoor activities as much as possible for the coming weeks. Now, this has been Chun Song-cho reporting live from No1 Life Treatment Center, and back to you, Sunny, in the studio.
All right, Song-cho, commitment is what we need, yes, from the members of the community. Thank you for that coverage.
환자 발생 지역도 수도권 외에 전국으로 확대되고 있고 실제로 확산세가 매우 심각한 상황으로 언제 어디서나 누구라도 이제는 코로나19 환자가 될 수 있는 상황입니다.
Since August 14th, Korea has been recording three-digit numbers in daily infections with a peak of 441 cases just yesterday. Authorities have described the latest steady rise in transmission as the calm before the storm. Now, for more on this rather unsettling forecast, I have Professor Chung Ki-seok from Hallym University. Welcome back, Professor Chung.
Good afternoon.
And I also have Dr. Alice Hyun-kyung-tan from Ms. Medi Women's Hospital. Good to see you back.
Thank you for
Dr.
having me.
Tan.
Thank you for having me.
Right, Professor Chung, there have been conflicting reports, that is, with regard to the peak of the latest outbreak. We have one report by the JP Morgan Chase, which predicts that net infections will peak by the end of this month, but health authorities here in the country are more cautious, claiming that there are many variables to consider. What is your assessment?
Yeah, nobody knows exactly what happens in the future, but definitely we are going through in the middle of a second wave of COVID-19 pandemic. It started 14th August. It's already 2 weeks. So if we have kept the quarantine rules in a proper way, we'll see a flattening of curve in a week time or so. There will be a beginning of September. But if not, we'll see a more increase of confirmed cases thereafter. So maybe we'll be meeting a shortage of medical resources and etc.
I see. Dr. Tan, an analysis of Korea's recent cases shows the majority was seeded by the GH strain of COVID-19. Some claim it's more contagious, while others claim there is a lack of scientific data to prove this claim. Please tell us more about the GH strain.
Right, so in Korea, we saw a shift between a prominence of the SV groups to the GH strain, and this happened around April. Dr. Betty Korber is a researcher who has been studying changes in the spike protein of the virus. And her group noted that the D614G variant, which is part of the GH strain, seems to be gaining dominance around the world, globally. And the reason for this, they predicted, or through their research they showed, is that it seems to be growing to higher titers in an experimental setting. And also patients who actually have this strain, they have lower what's called a CT value. They have lower values on PCR testing, which suggests that they have more of the virus in their upper respiratory tract. That would mean it's easier to transmit the virus. Now, it's not associated with any higher severity, which is good news, but it does seem to suggest that we need to work harder to get the virus under control. If we look at what happened early on with the virus in China when we were dealing with the S and the V groups, the R0, which is the basic reproductive rate that lets us know how much the virus is spreading, that was predicted to be, or calculated to be, between 2.2 and 3.9. However, last week in Korea, we're now dealing with the GH group. The R0, the real-time R0, was somewhere between 1.65 and 2.12. So even though we're dealing with a virus that may be more infective, we're having to do more to get maybe similar amounts of control. Now, that being said, the GH group became more dominant first in Europe, then North America, then Oceania, and then finally Asia. In Europe, they're going through a resurgence, but say in Germany, they were able to bring the virus under control. They were able to bring the R0, the reproductive number, under 1, even though they were dealing with the GH group. That means it can be controlled. But as I said, we're going to have to maybe work harder to get that control going. More concerning to me than the GH variant are the human factors, the human behaviors that need to change in terms of mobility. The data, I think, showed that in terms of people moving around on the subways, on the streets, that percentage only went down by 20% this last weekend compared to the weekend before, whereas it went down 40% during the Daegu Gyeongbuk outbreak. That means people are, they're not as alert, they're not taking this as seriously. Also, church members were still having service, incredibly, defying bans, even during level 2. And so these were the more concerning aspects rather than the GH variant.
Right, see, the human factors then. Professor Chung, amid the resurgence in cases, some believe a particularly worrying reality is the growing presence of infections that cannot be traced. Now, I understand such cases account for about 30% of the latest infections. What are your thoughts on this?
It's a problem, but you have to think about two factors. There are too many patients, and the EIS, Epidemic Intelligence Service, cannot trace. So there are not many experts in that field. So that is one thing. And the other one is there are lots of epicenters here and there in all over the country. Almost all cities are infected at the moment. So anyhow, we are seeing more than 30% of unconfirmed cases, which we do not know the sources. That means the infection is spreading more widely and more silently.
Dr. Tan, authorities here are asserting that the daily number of infections for this coming weekend will determine whether or not our efforts to flatten the curve are bearing fruit. I'm afraid I'll have to interrupt our studio discussion right now because I hear that the press briefing, that is the regular afternoon briefing on COVID-19, is poised to commence soon. We have our studio session after that briefing will include a guest also from Australia, Professor Michael Ward from the University of Sydney, joining Professor Chung and Dr. Tan with our studio session. We'll come back to you after this briefing.
First, we have Director Chung Eun-young with the explanation. Let us now begin our regular briefing for the COVID-19 response here in South Korea. As of August 28th at midnight, we have a total of 359 new local infections, and the total caseload now stands at 19,077. 19 more people have been discharged following full recovery, and a total of 76% have been fully recovered, while a total of 4,210 people are in quarantine. There are 58 patients with severe or critical conditions. We had 3 more fatalities. The death toll now stands at 316. I extend my deepest condolences to the deceased and the members of the bereaved families. And let us now look at our major updates of the domestic transmission. In regards to the Headquaters Church, we have confirmed 19 more patients, and we have a total of 979 cases being confirmed, 78 being confirmed, and a majority of them are in the metropolitan area as well, and the church members and the visitors. And by age group, about 27% are in their 60s, and we also have a very high rate in the elderly population. And as of now, in relation to Headquaters Church, we have confirmed that for the further chains of transmissions have in relation to about 25 venues, and a total of 150 confirmed cases of further transmissions stemming from the church have been confirmed. 9 of them were churches and religious centers, and others included various venues including nursing hospitals and office buildings as well. And as for the August 15th Seoul rally, we have confirmed 21 additional cases being confirmed. In total, we have 294 patients being confirmed to date. And 131 of them were attendees to the rallies, and about 91 of them were secondary and tertiary infections, and 7 were police men. And most of them also were in the capital area as well. And in relation to the rally, we have confirmed that secondary and further transmissions have been accounting for about 6 venues, and about 61 people have been confirmed in these 6 venues, and epidemiological investigations is underway as well. And as for the 6 religious facilities, we have 61 additional patients in relation to the rally. And the Wuhan group, we have 10 more additional cases, and a total of 66 cases have been confirmed, and they include a massive and a large cluster infection in the Suncheon city as well. And we have confirmed that in relation to the apartment complex in Gurogu district, we also have 33 confirmed cases to date. And in relation to the epidemiological investigations, we are identifying the sources of infection right now. And as for the Bikaun Church in Noanggu District, Seoul City, we have our first index case on the 22nd of August. We have 16 additional patients and a total of 17 have been confirmed to date. And in relation to a family in Busan City, we have confirmed that the index cases were identical with the group of the social gathering in Kimhae as well as another cluster. And we have confirmed that they went to a country club in Ulsan. And starting from 11 a.m. to 6 p.m., they engaged in sports activities as well as a utilization of the restaurants there. And in Gwangju, we also have a table tennis group. 2 more people have been confirmed to date in relation to this, and a total of 14 have been confirmed to date. And let us now look at the numbers of imported cases. We have 12 being confirmed today, 8 of which have been confirmed during points of entry, while the rest 4 have been reported on self-quarantine. 8 were South Koreans, and the rest were the foreigners. And 9 were from Asia and 3 from the US. The KCDC continuously notes that we have higher infections among the churches. And as for the churches, we have conducted our analysis, and the findings are as follows. A total of 12 churches have been confirmed to date, and about 1,460 cases have been confirmed at these churches, and they include also nth transmissions as well stemming from these churches, and they also exclude some other churches that have been mentioned previously during the briefing. And in relation to the Sarangjeil Church, we have a majority 955, and we also have about 40 in the Gospel Church, Full Gospel Church in Yeouido, as well as the Galilee Church in Incheon, 39 in the Galilee Church, also 21 in the Incheon Namdonggu District Church as well. And in Yongin City, in relation to Yongin Tail Church in Gyeonggi-do Province, about 203 were reported there, and also Rejoice Church in Goyang City, 21, also the Spring of the Lord Church, about 20 people as well, and Chungnam Dongsan Church, we had about 15 people there, and Seongnim Baptist Church, about 31 people in Gwangju City. And also in relation to the Liberation Day rally, we have seen 5 additional churches that have been stemming from the rally, and we also identified the Bikaun Church that has been revealed today that were stemming from these Seoul rallies. And we identified some risk factors. First, they had held physical services, they did not have ventilation, and they did not wear face masks, or at times they wore face masks in a non-proper manner, and they also had group dinings together inside the churches. And aside from the regular services, they also carried out diverse events, including retreats, small group meetings, as well as prayer services. And at some churches, there were some worshippers that have went to the services regardless of their symptoms, and also it spread to other parts of the community like offices, nursing hospitals at a very fast pace. And these infections stemming from these churches have spread to other corners of the society and are also spreading throughout the nation as well. And starting from tomorrow, as we enter the weekend, we ask all of the churches to switch your services to online means, and we also ask you to comply with the administrative order of banning all of the group gatherings, including group meals and so forth. And the KCDC also would like to note that we have many cluster infections stemming from the vacations as well and small gatherings. And in relation to social gatherings, we have identified the cases as follows in the table that you have in your press kit. They include the Luteria meeting in Yangpyeong-gun County, and as well as a social gathering in Anyang City, and a family meeting in Cheongju, and also Kimhae Golf Club meeting. And we have 100 258 confirmed cases in about 11 provinces and cities nationwide. And please note that COVID-19 spreads not only in the high-risk facilities, and it is not about the venue that increases the risks of infection. However, the social gathering that which engages other members aside from your family could increase the risk of infection. So we ask you to postpone or cancel your social gathering plans. And if you have to step outdoors, please wear your face masks at all times. When you wear your face mask, you need to cover your mouth and nose completely. Do not touch your mask surface with your hands, and also keep mask on at all times. Moreover, in order to curb the virus, and we believe that it is very important for the members of the public to carry out your compliance to the social distancing level 2. So please abide by these public guidance going forward. Aside from essential travels, including getting medical care, buying necessities, or going to work, please postpone and cancel all of your gatherings. And if you have to step outdoors, please wear your face masks at all times. You need to also wash your hands on a regular basis and also keep a healthy distance with others. If you have symptoms like fever or respiratory symptoms, please do not go to work, or please do not go outside, and get tested as soon as possible at a nearby local public health center or screening clinic. And as for the elderly citizens who are categorized as a high-risk group, and we ask for you to take particular caution because you could also have a higher chance of developing into critical conditions. If we cannot flatten the COVID-19 curve, if you continue to see an on-day increase of about 300 and 400 on a daily basis, and we continue to see higher number of age dispersion of the age group over the age of 60s, and thus it is also leading to a higher number of people with critical conditions. And we also have many cases where people who are confirmed over the age of 80 are leading to death, and we believe that this is a very grave, serious condition. And we have also seen that the virus has been spreading to very essential institutions like the government complex as well as National Assembly and so forth. And we believe that the COVID-19 does not only impact our health, but it also incurs damages and losses to all of our society as a whole. And some of our epidemiological experts have forecast that if the current conditions continue to next week, we would have between 800 and about 2,000 cases on a daily basis, and this could lead to a massive outbreak. If we cannot contain the virus, we will face the number increasing at an astronomical rate, which could also lead to a disruption of the medical services, and this also could incur great economic losses as well as social losses as well. However, the only way for us to contain the COVID-19 is actually very simple. It is all about minimizing social contact with others. So for the next 10 days at a minimum, please refrain from making social gatherings, events, or travel, and unless they are essential travels, including going for medical care or buying necessities or going to work. And we also ask for all of the worships and religious services to also switch to non-face-to-face meets. And second, if you are meeting with other people aside from your family members, wear your face masks at all times, wash your hands on a regular basis, and keep 2 meters of healthy distance. The COVID-19 is spreading. It is an issue affecting the health of myself, your family members, and your neighbors. And please remember that this also directly relates to our national economy and society. And let us stay concerted efforts as well. Thank you very much.
Right, that was Chung, the head of KCDC, with Friday's regular briefing on the COVID-19 situation here in Korea. She has highlighted yet again the importance of abiding by social distancing to keep the virus at bay, and has reiterated calls for all unnecessary engagements outdoors to be postponed. Now, I do suppose, Dr. Dan, that she was essentially addressing the human factor that you mentioned as being responsible for the latest surge in cases here in the country. Do you suppose that the measures, social distancing measures, within the 10-day period that she has mentioned will serve to perhaps flatten or ease the curve a little bit?
I think that we will see flattening of the curve. I think, though, we're instead of acting proactively, we've let the horse out of the barn a little bit, and it's a little bit too little too late. And right now we're backtracking and trying to put in more severe measures to really try to get this under control. However, there's a historian who studies pandemics who said that whatever measures that were seen to be too extreme to control a pandemic at the outset were found in hindsight to have been not enough. I'm afraid that we may find that to be true for our current situation, but that is why we need to align the government policies with the recommendations of the KCDC, and that alignment has to be 100%. And so the citizens of Korea, we need to listen to the recommendations of the KCDC and follow them 100%. And that's really more stringent than what the government is allowing for if you really follow and listen to what she's saying. And hopefully that will be enough to avert a major, major outbreak in our country.
Right, hopefully. Right, now, as I mentioned before the start of the briefing, we have a third guest joining us live via Skype from Australia. Welcome, Professor Michael Ward from the University of Sydney.
Hello, Sun-hee.
Right, Professor Ward, I understand you recently conducted a study that shows the weather may in fact affect the spread of COVID-19. Do share with us the findings of your study.
Yeah, sure. What we did, we looked at cases in the Sydney area, and we looked at weather patterns, and we looked at humidity and at temperature and at wind speed and also rainfall. What we found is whichever part of the epidemic, whichever region of Sydney, it was humidity, relative humidity. So the lower the humidity, the drier the air, the more cases we were seeing. And this is consistent with some other studies now coming out around the world. And it's also consistent with some of the laboratory studies showing that it's that dry air that seems to prompt the transmission of coronavirus.
I see. So essentially speaking, Professor Ward, the winter weather condition of low humidity could fuel a rise in community transmissions then?
That's true. If there's transmission going on, those are the conditions that seem to prompt the spread of coronavirus.
I see. Professor, Dr. Dan, that is, I believe you have a question for Professor Ward.
Yes, Professor Ward, thank you so much for joining us from Australia. Here in the Northern Hemisphere, public health authorities have been warning of increased COVID activity in the upcoming fall and winter months. I appreciated the findings of your study. Now, of course, we can't do anything about the weather, but we can certainly step up hand washing, social distancing, and the wearing of masks. And we can let the public know that these measures will need to be intensified in the upcoming fall and winter, given what we expect in terms of the climate. Now, I have a question, and you may or may not be able to answer, but do your findings have any implications about what a safe humidity setting would be indoors in order to prevent COVID-19 transmission? Because, of course, we can't control the weather, but we can control indoor humidity.
Thank you. That's a really interesting question. The studies so far, they've been based on weather recorded data, so outdoors data. The big issue is how do we extrapolate that from outdoors to indoors? There is a correlation, and it does suggest that perhaps our indoor environment, particularly we prefer drier indoor conditions, that might actually help with the transmission of coronavirus. So it's sort of something that really does need more research, that can we modify indoor environments to somehow suppress coronavirus transmission? That might be a temporary increase in the humidity. So it has quite a lot of implications. It's something that really needs more research.
I see. So perhaps the use of a humidifier, that is, this winter might be better then. All right.
It could do. We really need the evidence, though, to make those recommendations.
Right. Professor Chung, here in Korea, the government has warned of stern punitive action against those who undermine containment efforts. Now, despite this, we continue to see reports of people breaking quarantine orders, giving false testimony and refusing to get tested altogether. Speaking as the former head of the KCDC, Professor Chung, what can be done to address this senseless behavior?
First of all, the government should send a strong message. They should get a example. So the example of implementing a punishment. So a few examples will let the people to follow the quarantine orders or quarantine rules. Secondly, the risk communication is very important. The government should keep telling people that how risky is the COVID-19 and how infectious is it and what's the fatality and what's everyone's role in preventing the infection. So then the people will follow the government direction.
So perhaps raise more awareness about the dangers of COVID-19. Yes. Dr. Tan, alongside rising cases of COVID-19 patients are the rising numbers of those who need to be self-isolated, quarantined that is. Could you perhaps remind us about who is subject to self-isolation and what rules apply during quarantine?
Right, so we have more than 60,000 people who are now in quarantine. 33,000 are due to related to domestic cases. So they are people under investigation. They've been in close contact with an infected person. And then the other 30,000 are travel related. So they're people who have traveled from outside and come into Korea. A very small number, so a little over 1,000 people are actually in a government-sponsored facility. Everyone else is quarantining at home. Importantly, we should note that more than 500 people over the last 2 weeks have been found to be positive while they were in quarantine. So this is actually a very, very important measure. It's very difficult to endure quarantine for 14 days. Basically, in Korea, you are not allowed to leave the house unless you have received permission from someone in your community health center, and that would be for perhaps a medical reason. You would get permission and then arrangements would be made for you to be transported by ambulance so that you don't come in contact with anybody else. The purpose of quarantine is to isolate potentially infected people during that latent period of 14 days from coming into contact with anybody else. Ideally, you should be living in your own quarters, separate from anybody else. But if you are sharing a home with other family members, then eating, sleeping, toileting, just simply staying should be done in separate quarters. You should not be sharing any personal objects or eating utensils, plates. Your laundry, your waste needs to be handled separately. And then ventilation is going to be very important in any shared spaces, along with cleaning and disinfection, of course. Lastly, it may sound self-evident, but there are no visitors allowed. And of course, this was a problem that we had down in Busan, where someone in quarantine was seeing visitors. It sounds very obvious, but I think worth mentioning that you're supposed to separate yourself from society until your PCR tests come back negative and it is deemed safe for you to now go back into society and mingle with other people.
Right, definitely. Professor Ward, I understand that Australia has a zero-tolerance policy for those who violate quarantine or containment efforts. Please tell us more about this.
Yes, I think it's probably similar to Korea. There have been penalties, there are fines and so on for people found not to be at home when they're meant to be in isolation. So the police are conducting regular checks. They're checking on people that they're at home. And in one study in Melbourne, they did find quite a few people were not at home. So there is that enforcement, and it's based on fines.
I see. Professor Ward, if you have any questions for our medical experts here in the studio, please do go ahead.
Thank you. I was reading a very interesting research article just the other day. It was about the clinical symptoms of COVID-19. Maybe Professor Jung, you've heard of this. There seems to be a predictable sequence of symptoms that start off with a fever and then cough and then I think vomiting and diarrhea, and they happen in that sequence. Have you found that? Can you comment on that?
Yeah, I think this is a very interesting study. There are not many clinical trials which looked at the sequencing of symptom complex. But in some part, it makes sense that it follows anatomical structure, exactly. So starting from fever down to a lung and the coughing, and the vomiting is from stomach and end up with a large intestine, which causes the diarrhea. But as you know, there are many confirmed cases without any symptom. And some patients have only loss of smelling or loss of taste. So I don't think it's a typical sequential symptom complex which typifies COVID-19, but we can consider it to be one type of COVID-19 syndrome.
Professor Ward, I hear authorities there in Australia are planning to offer free vaccination to all Australians. What is the public response to this measure?
I think in general, it's been good. So there was an agreement, memorandum of understanding, I think, to purchase the Oxford vaccine if it's proved to be effective. So I believe it's 25 million doses, and the government would make that vaccine freely available. They did this year with the flu vaccine, so there is a precedent for doing this.
I see. Well, that is good to hear. All right, Professor Wu, thank you very much for joining us live from Australia. And Professor Chung, as always, thank you for being with us. And Dr. Tan, it was a pleasure to have you on the show.
Thank you.
Right, well, that ends our coverage for this work week. Do join us again next week for more on the COVID-19 pandemic. In the meantime, do seek to limit unnecessary ventures outdoors and to refrain from activities that could raise your chances of possible contagion. Have a good weekend and see you next Monday.